Namaste Bitya, Hamesha Khush Raho Bitya. A very good morning to you all. Myself, JV and Dr. Ravi Jain, Assistant Professor, Department of Practice of Medicine and Faculty of Homeopathic Science at JAYOTI VIDYAPEETH Women's University, Jaipur. In today's lecture, we are going to discuss about the primary headache. In the last two lectures, we have discussed about the classification of the neurological disease. In the last lecture, we have discussed about headache. What is headache? What are the different classifications of headache? What are the different type of headache? We have discussed about the primary headache. We have also discussed about the secondary headache. Then we have discussed about how to do the evaluation of headache. What is the serious case and what is not the serious case, and how to evaluate the symptoms, how to do the diagnosis in case of headache. So all these things we have discussed in the last lecture. I believe you must all have gone through the book and you must all have prepared your notes from the e-notes I have given and also from the book. You must all have also completed the topics or the questions which I have given you in the last lecture. So now I believe that you all have completed your homework. So let's start with today's lecture with the primary headache. So today we are going to discuss about the primary headache. So what is the primary headache? In the last lecture, we have discussed about the primary headache. So what was primary headache? Primary headache was one that was associated, the headache and its associated features that were the disorders themselves, and they were not result of any other medical condition. So primary headache, it is these are the disorder in itself and they are not the result of any other medical condition. We had also done the classification of primary headache as a different type of primary headache, which included the most important or the most common type, that was tension headache. Next, we had migraine. So tension headache was seen in 69% of the cases. Migraine was seen in case of 16% cases. Third variety was idiopathic stabbing pain, that was seen in case of 2% cases. Next, we had exertional headache, that was seen in 1% cases, and cluster headache, that was seen in 0.1% of the cases. So let's start with the tension headache type first. So I have already done the classification of primary headache, and I've also told you the definition of primary headache. Now we come to the tension type of headache. It is the most common type of headache that is seen among the most common individuals or the maximum individuals. So what is tension headache? Tension headache is, so the tension headache is the most common type of headache that is seen in all the age groups. And this headache usually builds slowly. So you are going to see the tension headache that is building slowly, and it may persist for hours or days. The tension headache can persist for hours and days altogether. So it is the most common type of headache and it can be seen in all the ages. All the age group people are affected by the tension headache, and it is usually building slowly. Slowly and steadily it is affecting all type of population, and it can persist for hours to days. It can persist from few hours to many days. And it is described as the bilateral tight band-like discomfort. So whenever a patient of tension headache is coming to you, he or she will describe the complaints as a band-like, tight band-like discomfort observed in the head. The pain is managed by simple analgesics. So the pain that you are going to see will be managed by simple analgesics that includes acetaminophen, aspirin, and NSAIDs. So this was all about tension headache. Tension headache, let me revise you. It is the most common type of headache that we are going to see. It is common in all the age groups, and it is usually built slowly. It may persist for hours to days, and it is described as bilateral tight bandage or tight band discomfort. And the pain is managed by simple analgesics. So most of the people are taking simple analgesics and different oral over-the-counter drugs for management of such pain, like acetaminophen, aspirin, and NSAIDs. Next variety that we are going to discuss is the cluster headache. Cluster headache is not very common, but it has typical features. It is seen in around 0.1% of the individuals. And I have shown you the picture of cluster headache. Cluster headache is localized to one particular eye of the patient, and you will see sweating. There will be swelling of the eyes and tearing pain with the running nose. So there will be severe excruciating pain in the eyes with sweating. There will be swelling, tearing, and running nose that you are going to see in the patient. Now, cluster headache is a series of relatively short but extremely painful headache. So whenever you are going to see a patient of cluster headache, it is a very severe type of headache that you are going to experience in the patient. So these are the series of relatively short. So this pain is usually occurring for a very short period of time, but these are extremely painful headaches. Headaches that are remaining for weeks for days or to weeks to month at a time. And it is usually occurring in the cylindrical pattern. Cylindrical pattern means the clusters. The pain is coming in the clusters. When a short time of pain followed by the time of well-being. So it is a series of relatively short but extremely painful headache that is occurring for days, weeks, to months at a time and occurs usually in the cylindrical pattern that is known as the cluster periods. Now, the cluster headache is characterized by episodes of recurrent deep unilateral retroorbital searing pain. So it is occurring at one side of the body, not both the sides of the head is affected, and it is episodes of recurrent. So this pain is occurring again and again. Deep unilateral pain with the retroorbital searing pain. So there is episodes of recurrent pain, deep unilateral retroorbital searing pain that we are going to see. There is unilateral lacrimation. So there is lacrimation, unilateral lacrimation of the patient, and nasal and conjunctival congestion may be present. So there will be unilateral lacrimation and nasal and conjunctival congestion that may be present. The prophylaxis with verapamil and prednisolone is done. So in this case of cluster headache, because it is a very severe pain with heavy clusters, unilateral retroorbital searing pain that is causing too much discomfort to the patient. So the prophylaxis can be done by medicines like verapamil and prednisolone. And high flow oxygen is given in such cases during the acute attack. Now, the third variety or the second most common variety is the migraine. What is migraine? Migraine is a very important pain and most common type of pain that is observed in a lot of people. So what is migraine? Migraine is a neurological condition that can cause multiple symptoms. So in the migraine, it is basically a neurological condition that causes multiple symptoms in a patient. Migraine is not just a simple headache, but it can cause multiple types of symptoms in different types of people. Now, what happens in migraine is it is characterized by intense debilitating headaches. So there are intense pain, intense debilitating headaches. So these pains are not only very much severe in intensity, but it is also stopping the patients from doing different type of day-to-day activities. So debilitating, there is debility, there is tiredness, there is fatigue in the patient. So it is a neurological condition that can cause multiple symptoms, and it is characterized by intense debilitating headaches. The symptoms of headache includes nausea, vomiting, and difficulty in speaking. So along with the headache, there is nausea and vomiting. So the patient will say the patient is not only having the pain, but also having nausea and vomiting with difficulty in speaking. There is numbness or tingling and sensitivity to light and sound. So the symptoms includes nausea and vomiting with difficulty in speaking. There is numbness and tingling with sensitivity to light and sound. Now, there is extreme sensitivity to light and sound. The patient can neither tolerate light or sound. There is a classical triad. Now, what is a classical triad? Classical triad of migraine includes premonitory visual scotoma or scintillations. So in the classical triad, we have premonitory visual. There is visual and scotoma and scintillations. I have uploaded the picture of this scotoma and scintillations in the PPT that I have attached in the portal. So in the classical triad, we have premonitory visual that includes scotoma and scintillations. There are different type of auras that are sensory and the motor, and unilateral throbbing headache. So what happens in a migraine? Migraine is basically a neurological condition that can cause simple multiple symptoms, and it is characterized by intense debilitating headaches. The symptoms includes the nausea, the vomiting, difficulty in speaking. There is numbness or tingling and sensitivity to light and sound. There is a classical triad of premonitory visual scotoma and scintillations with sensory or motor symptoms that are known as aura. There is also unilateral throbbing headache with nausea and vomiting. So unilateral pain with nausea and vomiting is seen, and it is the second most common cause of headache and the most common neurological cause of disability in the world. So this migraine is the second most common cause. This I have already discussed with you. It is the second most common cause of primary headache, and it is the most common neurological cause of disability throughout the world. Now it affects around 15% of the women and 6% of the men in women. So whenever migraine is occurring, it is affecting around 15% of the women and 6% of the men annually. And usually migraine arises in the childhood, or it can arise in the adolescence or early adulthood. However, the initial attack may occur at any age. So any age group can be affected by migraine. It can occur in the childhood, it can occur in the adolescence or adulthood. So any age group is susceptible for development of headache. Family history is often present in case of migraine. So migraine runs in families, and women have an increased sensitivity to attack during the menstrual cycle. So this is seen that during the menstrual cycle, the females are having attacks of migraine. Now, what is the pathogenesis? The exact pathogenesis of migraine is not known. It is not clear, but there are certain theories that are given. So the sensory sensitivity, it is due to dysfunction. So the sensory sensitivity that is seen in case of migraine is due to the dysfunction of the monoaminergic sensory control. So the sensory sensitivity is, or the dysfunction of monoaminergic sensory control system that is located in the brainstem and the hypothalamus that is seen. The blood level of the histamine, serotonin, and norepinephrine is increased. So there is sensory sensitivity due to the dysfunction of monoaminergic sensory control system that are located in the brainstem and the hypothalamus. The blood levels of histamine, serotonin, and norepinephrine are increased. So what is happening in this particular disease condition is there is sensitivity due to dysfunction of the monoaminergic sensory control system that are located in the brainstem and hypothalamus. The blood level of the histamine, serotonin, and norepinephrine is increased. Now, how to diagnose a case of migraine? Whenever a case of migraine is coming to us, how to diagnose a particular case? So, in order to diagnose the case of migraine, number one, we have to check for the repeated attack of headache. So there must be repeated attack of the headache that is lasting for 4 to 72 hours with the normal physical examination. So a patient, whenever is coming to us with the repeated headache attacks lasting for 4 to 72 hours with a normal physical examination with no other reasonable cause for headache, can be diagnosed as migraine. So if you are getting a patient with repeated attack of headache that is lasting for 4 to 72 hours and the physical examination is normal and there is no any other cause, reasonable cause for the headache, with at least two of the following features should be present. So a pain lasting for 4 to 72 hours with normal physical examination and no other reason for the headache, plus two of the following features. We have unilateral pain. There should be a unilateral pain or the throbbing pain. So there can be unilateral pain, there can be throbbing pain. The pain can be aggravated by movement and it can be moderate to severe intensity. So out of the four things, two things should be present. What are the four things? Number one, we have unilateral pain. Second is throbbing pain. Third is aggravated by movement. And the fourth is moderate to severe intensity. If any two things out of the four is present, plus one of the following features, either nausea or vomiting or photophobia or and phonophobia. Phonophobia is basically extreme sensitiveness to noise. So two features out of the four that are unilateral pain, throbbing pain, aggravated by movement, moderate to severe intensity. And one out of the two, that is nausea and vomiting and photophobia and phonophobia. So these things are required to diagnose a case of migraine. Now, what are the symptoms of migraine? Whenever a patient of migraine is coming to us, what are the signs and symptoms that can present to us? The patient can have a variety of symptoms. The variety of the symptoms includes nausea that is seen in around 87% of the cases. So the patient can present with nausea. You have to remember the 6 symptoms that I have already told you. First thing was the headache should be present in order to diagnose a case of migraine. Headache lasting for 4 to 72 hours with a normal physical examination and no other reasonable cause for headache. Plus two of the following 4 features, that is unilateral pain, throbbing pain, worse by motion, and moderate to severe intensity, plus one of the two features which include nausea and vomiting and photophobia and phonophobia. Plus the symptoms can be present, symptoms like nausea, we can have the patient with nausea. Nausea that is very common, it is seen in around 87% of the patient. Photophobia, photophobia in around 82% of the patient. Lightheadedness, lightheadedness is a feeling of vertigo-like feeling. It is seen in 72% of the cases. Scalp tenderness is 65% of the cases. Vomiting occurring in 56% of the cases, with physical disturbances seen in around 36% of the cases. Different type of paresthesias, that is perverted sensations like pricking sensation, crawling sensation. These are seen in 33% of the cases, with vertigo that is seen in 33% of the cases. Photopsia in 26% of the cases. Alteration of consciousness seen in 18% of the cases. Diarrhea seen in 16% of the cases. Fortification spectra. There are different types of spectra that are known as fortification spectra. I have given the picture of that fortification spectra in the PPT. So it is seen in 10% of the cases. Syncope, that is becoming unconscious, seen in 10% of the cases. Seizures in 4% of the cases, and confusional state, that is seen in 4% of the cases. So I have discussed about the diagnosis. In order to diagnose a case, we have to check for the pain lasting for 4 to 72 hours with normal physical examination, no other reasonable cause. Two of the following 4 features: unilateral pain, throbbing pain, worse by motion, moderate to severe intensity. One of the following 2 features: nausea and vomiting, photophobia, phonophobia. And symptoms includes nausea, photophobia, lightheadedness, scalp tenderness, vomiting, visual disturbances, paresthesias, vertigo, photopsia, altered consciousness level, diarrhea, fortification spectra, syncope, seizures, and confusional state. Now, what are the treatment for migraine? Whenever a patient of migraine is coming to us, it is not easy to treat, but there are different treatment protocols that could be followed. We can go for non-pharmacological approach, we can go for pharmacological approach, and we can go for prophylaxis. Prophylaxis means treating the pain before it is occurring. So in the normal non-pharmacological approach, in which we do not give any medicine, so avoidance of the triggers are done. So we have to identify the trigger factors that are responsible for development of pain. And after the identification, then we have to avoid those triggers. Next is the pharmacological approach. In the pharmacological approach, we are giving medicines to the patient, which includes simple analgesics and NSAIDs. And the third is prophylaxis. In the prophylaxis, we are preventing the attack of migraine by providing tricyclic antidepressant and verapamil. So in the management, we have talked about the non-pharmacological, in which we are avoiding the triggers, pharmacological, in which the simple medicines like simple analgesics and non-steroidal anti-inflammatory drugs are given, and prophylaxis that is done by tricyclic antidepressant and verapamil. So this is all about the primary headache, the different type of primary headache. In the next lecture, we are going to discuss about the MIDAS, more about headache. Okay. So now it's your homework to go through the book, and you also have to search about the MIDAS score. So it's your homework to search about the MIDAS score for headache, and go through your book and learn the different aspects of headache, primary headache. So this was all for today. In the next lecture, we are going to discuss more about headache and the different type of headaches. So I hope you have understood this session properly. This session is powered by Digital Version 2.0 JAYOTI VIDYAPEETH Women's University. I hope the session is clear to you. If you have any query, please mention in the comment box and I'll try to resolve it. So this was all for today. Thank you very much. Have a good day.